Peter Chinamora. I'm coming from the Catholic Trust. We are a disability service organization. We are partnering with the ministry in looking at the needs of children with disabilities. Our interventions are mainly looking at the various vulnerabilities that children with disabilities face, especially given the various emergencies that we are encountering as a country. I think number one, we are talking about the COVID-19 outbreak, and also number two, we've had instances of drought in the country. And given this situation, it makes it very difficult for parents and caregivers to provide for the specialized needs of children with disabilities. So our interventions mainly are looking at lightening the burden for parents in terms of accessing services. For example, when you look at a child with a disability, they need regular therapy, that is physiotherapy and occupational therapy, for them to be able to function normally. And also, sometimes when they face incidents of abuse and exploitation, they might also need services that are not sometimes available in the community. So what we are doing is to bring these services closer to families and children through what we are calling disability mobile clinics. This is whereby we are working together with various government departments. Number one, the Department of Social Development. Number two, we're also working with the Ministry of Health, especially the Rehabilitation Services Department, where we are moving around in communities, assessing children and also helping them with assistive technologies. I think some of which you can see here today. We are also going beyond that. We are also looking at the vulnerabilities that children with disabilities face when it comes to issues of abuse. We are mainly working together again with the Department of Social Development in terms of looking at providing services that are accessible to children. Number one, for example, when children encounter abuse, especially children with disabilities, they might require services, including justice services. So one of the services that we are offering is actually assisting children to be able to access these services. In particular, we are looking at providing them with transport to be able to go to court where they are being processed through the legal system. And we are also looking at when they are going through court systems, there is what they call age estimations, because there is an extreme challenge in terms of birth registration for children with disabilities. So when they go to court, when they are being processed through the court system, they want to determine if they can process them as children or as adults. So we are helping them to get what they call age estimations. There's also what they call psychiatric evaluation, where when a child with a disability is processed through the court system, they want to assess the level of mental function and also to determine if the child can give credible evidence in court. So we are also assisting children to be able to access these services. And it's important to note that these services are only accessible in urban centers. For example, here in Lupane, the service is found in Bulawayo. So we are providing them with transport money, we are providing them with accommodation when they get to Bulawayo. We are also covering their meals as they are accessing these services. When we also look at the protection aspect for children with disabilities, we are also working with local communities. We have a cadre that we have in communities that we call community child care workers. As you know, there is a causal relationship between disability and poverty. Poverty causes disability, and disability causes poverty. So what we are doing at the moment is that we have realized through operational research that parents sometimes, especially given this emergency situation that we have, where we have drought and COVID-19, parents sometimes prioritize urgent needs for their household, for example, issues like food. But then for children with disabilities, where they have health needs, for example, where they need regular therapy, it becomes difficult for parents to provide. And one of the issues, again, when we talk about disability, there is what we call cost per child. It's very expensive to provide services for a child with a disability. For example, if you want to take the child to Bulawayo for services, there is the cost for number one, the child, and the accompanying caregiver. And where a wheelchair is involved, public transporters normally also charge separately for transport. So we are looking at a threefold charge when they are accessing services. So what we are doing is that we are helping families, especially given the fact that most children with disabilities come from poor families. We are helping families to be able to assist children to access these services. And we are also working with different government departments to bring these services closer to families through the mobile disability clinic setup. I can say in brief, Honorable Minister, this is what we are doing.